right, now is recording. Okay, so I was saying that exercise testing, I will focus more on a physiological point of view, but I also need to share this physical activity readiness medical examination for pregnancy questionnaire, because this is a normal procedure that should be taking place first before any kind of physiological test. So I'm not going to go deep, but I left the link in there, and you probably already know this questionnaire. So this should be taking first, because it will give us information on any kind of possibility of contraindication, and if there is, or if there are some suspect that the women may not be clear to perform exercise, we should instruct them to go to the doctors to have clearance to perform exercise. And there are two types of contraindications for exercise. They could be relative and they could be absolute. So the absolute, it means that, well, they should not perform exercise. The relative, they may be perform. So we will find these contraindications, for instance, in the American College of Sports Medicine. And as you will see, they are related with some conditions that may occur during this period. So for instance, severe anemia, which is related by the glucose levels more available for the fetus development. Some unevaluated maternal cardiac dysrhythmia, some chronic bronchitis, some type 1 diabetes mellitus condition, poorly controlled, extreme morbid obesity. Well, I would say that in these cases it's not recommended to become pregnant, or extreme underweight, the complete opposite. That also could be considered a relative contraindication. History of a sedentary lifestyle, intrauterine growth restriction in the current pregnancy, hypertension not well managed, some kind of orthopedic limitations, so poorly controlled seizure disorder or hyperthyroidism, and even heavy smoker. So any of those in this list, they are considered relative, because if they change a little bit, they may be not determine that the pregnant women cannot proceed to exercise. But there are also absolute contraindications, and in this case, they stop us to recommend any kind of exercise. So if we have any kind of heart disease, a restive lung disease as well, like chronic pulmonary obstructive disease, incompetent cervix circlage, multiple gestation at risk for premature labor, persistent second or third trimester bleeding. This is also not recommended for exercise. Placenta previous after 26 weeks of gestation, premature labor during the current pregnancy, ruptured membranes, or even preeclampsia, pregnancy induced by hypertension. So I already showed you before that this is a tricky situation that may be developed during the pregnancy period. It can be avoided, for instance, by just performing exercise. There is a lower probability to take in this, but still, if it is already there, we cannot continue for the recommendation of performing exercise for pregnant women. So regarding the testing itself, because before it was just a questionnaire, but the exercise testing itself, I would say that it also includes some assessment at rest. For instance, the blood pressure, the heart rate, and the glucose, they all can be assessed and also the body composition, sorry, they all can be assessed at rest, and some of them can be assessed during the exercise. For instance, the blood pressure, the heart rate, and even the glucose. But the glucose is not well, um, it's not used so much during the exercise, but the other two, blood pressure and the heart rate, they are. But what about cardiorespiratory tests or strength tests? So what can we do? I will give you some suggestions. I'm not going to go deeper by describing all the tests in detail because I'm expecting that you already have some information about some of those tests because some of them are general for everyone. Uh, it just depends. They are more recommended during this stage of life. So regarding the blood pressure, heart rate, and glucose, I would recommend to control or to assess these variables before the exercise. And I will give you in the later slides specific values to follow because sometimes if we have two lower values or two higher values of these three measures, sometimes we need to delay the exercise or to not do that exercise on that day. It just maybe try in the next day or the day after. Regarding the body composition and bioimpedance specifically, there are some research that supports the use of bioelectrical impedance analysis, also called like bioimpedance. They say that is non-invasive, is reliable, is a fast clinical approach, but I also would say that the specific devices as a manual of how to use it. And for instance, I put just a reference in here because at our university, we have the in-body SDS device, S10 device, sorry. And this device is very advanced for clinical research, also clinical applicability, but the guidelines or the manual instructions of this device recommends that it should not be applied for pregnant women. So, I mean, the majority of research that there is does not found any kind of harmful effects for the mother or for the fetus development, but still there are some manual instructions that said that the effects are unknown and sometimes the results could be also inaccurate. So I say that you can do it, but I will be no responsible if the results are going to be real, accurate, and if also there is no effect at all for the fetus at that moment or later. So I would say that body weight, height, body mass index, maybe some circumference, and even some skin folds will be safer at any time. Regarding cardiorespiratory testing, I would say that, well, there are many situations in this case to analyze. For instance, in cardiorespiratory testing, we usually have two ways. We can perform a maximal test or a submaximal test. Well, maximal tests are not recommended to be performed by pregnant women, unless they are medically necessary. So if we have a doctor present, we may conduct them, but probably there will be a specific reason to do it. Otherwise, they should not be recommended. Sometimes they are performed also for clinical research, but still, even in that cases, the presence of a doctor will be better to avoid any kind of tricky situation that may occur. So in that case, we should go with the submaximal test if there are no contraindications for the practice of exercise. And in this case, there are some recommendations that we should follow. For instance, if the restart rate is higher than 120 beats per minute, we should not go to the submaximal test. We have to wait until this number decreases, or maybe we can try in a different day. It's the same for blood pressure. So basically, if we have lower values than 140 to 90 millimeters per mercury, and not lower than 110 to 65 millimeters per mercury. Sorry, I think I put the units twice. But this value, if it's between these ranges, it will be fine. It's higher or lower than those ranges, it will be better to avoid again the cardiorespiratory testing. The glucose measurement before and after exercise, it's essential to ensure that the pregnant woman is not going to develop hypoglycemia, because if a value lower than 4 millimoles per liter is found, we should again avoid conducting this type of tests. And finally, I didn't put this before, but it's also a recommendation. It's about the oxygen saturation. So nowadays this is quite easy to measure. Some watches, smart watches, can do this type of assessment. There are also other devices that we put in the finger and it tells us the number. So if there is a drop higher than 5%, it will means exercise hypoxemia. So this measure can be taken before we start the exercise and during the exercise, because if this appears, maybe we can stop the exercise. Or if the number is too low, we should avoid again conducting this type of exercise. Of course, general recommendations, as for everyone, we should conduct a warm-up at least 5 minutes in order to decrease the risk of injury due to the relaxing effects. We should also perform a cool down exercise of at least 5 minutes. It could be longer, it could be at a light intensity, and the idea is to restore the baseline levels as they were before, or at least similar as they were before initiating this test. And the temperature of the room, if it's in a controlled environment like a room or a laboratory or something, we should keep the room between 20 to 22 degrees, and it will be better if we have the option for ventilation, because sometimes the body temperature rises too much, and in this case, well, there are women more sensible than other, and in this case it will be easier to control. So another variable that we can control is the body temperature. I didn't write it down in here, but I would say that is also recommended, especially in the first weeks of the gestational period. So not achieving higher than 39 degrees, it would be better. And in later stages, well, if we achieve 40, 41, well, it's not recommended as well. So that should also be taken in consideration. In terms of tests, well, all of these three situations are submaximal tests. The modified Norton test, the modified bulk test, and also the 6-minute walking test. I didn't put them described here, but basically all of them can be performed with walking stages. The 6-minute walking test is the same test as is applied for older people. So it's just walk about 6 minutes, and we take the distance possible that was taken for the pregnant woman, and we use that to classify the results. The modified walk test and the modified Norton tests are submaximal, but the original tests are maximal tests. But in these versions, basically, we should interrupt or stop the tests when the pregnant woman achieves around 80% of the maximal capacity that we determine before. So we can use a formula or we can use the previous value. It's not really accurate, but we should interrupt at 80%. This is what is recommended by some specific research for pregnant women. Regarding the strength testing, so there are many possibilities as well. There are other possibilities that I didn't write it in this slide. For instance, there are some isometric tests that can be performed for the hamstrings assessment, for instance, but I would say that, as I mentioned, isometric exercises could be not so healthy for the blood circulation aspect point of view, for the respiration point of view. So that for that reason, I didn't put them in here. I don't say that if you search for this type of articles, you probably will find one or two that used isometric tests, but I didn't use them here. With one exception. The end grip strength tests, basically, we are just requested to squeeze a device with our hands. Well, it can be considered an isometric test because there is no movement. We are just squeezing a dynamometer, but that is quite easy and it will give us a specific value in kilos or pounds that allow us to understand the strength levels of a woman. Then we have another two tests that are also quite common for older people. They can be easily applied and safe, secure for pregnant women. The 30-second chair stance test, which is performed during 30 seconds, basically lifting up and sitting down. The number of reps is what we are going to use to characterize the results. And the 5 times sit to stand test, a little bit different. So it's the same exercise, just 5 times, and we save the number of time that we need to conduct those 5 repetitions. Of course, another possibility is to perform a submaximal strength test. I mean by the multiple repetitions in a standardized exercise, like in a machine, with free weights if the person has some experience. So for instance, any kind of protocol, and you will find this information in the American College of Sports Medicine. For instance, you can perform any kind of protocol until 10 maximal repetitions. You will save that number, and then you can use an equation to predict predict the maximal strength from a specific exercise. This can also be performed, but it has a disadvantage that it takes too many times sometimes to do those exercises if we want to access many exercises. If it's just one or two, it's fine, but if we want to have the numbers for many exercises, well, it's a little bit time consuming, but it can be performed. Just a minor reminder, because before, for the cardiovascular tests, I said that we can use them and we can stop for the Norton, for the bulk test. We can stop them when we achieve 80% of the maximal heart rate. And how can we find the maximal heart rate? Well, we can use one of those equations. You probably know much more than those, but I would recommend to use these two because they are the last that were developed until this day, at least to my knowledge, and they are usually more accurate. The first one for people with 30 years or higher, and the second one that appears in this slide for people with lower than 30 years. So this is a general, these two are two general equations for everyone. They are not specific for pregnant women, but you can use them in the case you don't know what is the maximal heart rate. But please note that one physiological adaptation is that the maximal heart rate has a tendency to decrease. So why can you use them? Because these equations usually are they have a little bit of variation when compared to the real values of maximal capacities. So usually they give us a lower value than what actually is, not always, but many times. So I would say that you can use this number as a reference of the maximal, and then you will find what is 80% of that number if you want to apply a cardiorespiratory test. So here is an example how to find the heart rate training zone. In the case you want to use those tables before, you can use this type of equations to make the exercise prescription, but again, I'm just going to give you these examples, but I'm not recommending to use them. It's just for you to understand if it fits for the people that you are working with or not, because for some women it will may be helpful, but for other could be not so helpful. So in the case you want to use it, basically you can find the heart rate reserve by using the maximal heart rate minus the rest heart rate. And then if you want to work, as in this example, at 70% of the intensity, you multiply that number by, so you multiply the heart rate reserve by the intensity that you want to apply, and in the end, you add again the number of the rest heart rate. So in this scenario, let's imagine that we have 200 beats per minute of maximal heart rate, 6 beats per minute of rest heart rate, one minus the other is 140. So if we multiply 140 by 70%, it will give us 98 beats per minute. And if we add the rest heart rate, which is 60 beats per minute, it will give us 158 beats per minute. So this example that I put in here is not good for pregnant women, or it may be not good. Maybe for those that are athletes, this could be interesting, but for those that are not, this is considered a vigorous intensity, so it may be not so helpful. Regarding the exercise monitoring, so before I introduce the heart rate, you already understand that situation. The RPE is the abbreviation that stands for the rating of perceived exertion, the Borg scale, usually from 6 to 20 arbitrary units. It can also be used the modified scale between 0 to 10, so that can work as well. So you just need to ask the intensity that the woman feels during the exercise, and she will rate it in a 0 to 10 scale, and you will find what it means. But another one that is recommended for many specific associations that study pregnant women is to apply a talk test. And basically, this is quite easy. So you, for this type of test, you just need to make sure that it's possible to take, to continue to talk with that person during the exercise, and you just need to reduce the intensity if the pregnant woman is not able to talk without being out of breath anymore. Okay, so if she can talk with no problem at all in terms of breathing, it will mean that the intensity is fine. But if she's start to show that the normal breathing is not being taking cared, we should reduce the intensity. And to reduce the intensity, well, it's if it is a cardiovascular exercise, we just can reduce the time, we can interrupt, make a pause. If it's walking, we can slow the pace. If it's cycling, we can slow the pace or any kind of situation. If it's for strength training, we can decrease the load, we can decrease the number of repetitions, number of sets. Well, as you know, there are many possibilities. And then I think this is the last part. Some warnings to pay attention that we should follow in order to stop the exercise if they occur are these ones. So vaginal bleeding or amniotic fluid leakage, shortness of breath prior to exertion, dizziness, feeling of faint, headache, chest pain, muscle weakness, calf pain or swelling, decreased fetal movement, and even preterm labor. So if any of those happens or occur, we should stop immediately the exercise. So, well, I think we have still 10 minutes. I just put in here my web pages, some information about my scientific networks as well, and my email. So with this in mind, I would say that if you have any questions for the remaining minutes of the session, you will be free to ask. If you don't have questions now and you have later, you can contact me by email, of course, or by WhatsApp. You also have my contact there. I would say that I have a worksheet to do, but well, we don't have any more time, and it will be more interesting if we have more people in the session. So since we are a small group, I will save it for another day. So any questions that you have for me? No questions? I don't know. I know it's a heavy session because it's basically 3 hours of a session with too many information, too many variables. Physiological aspects are also a little bit dense because they have many topics, but still, yeah, if you have no questions, no problem at all, you can contact me later, okay? So that being said, I would say that we can finish the session for today. And if you need anything from my part, just let me know. Okay?
Okay, thank you very much.
Thank you. Thank you.
Okay, thank you.